Hi, my name is John. I'm going to be your nurse today. Could I get your first and last name and your date of birth, please?
Yes, Lindsay Carruthers, January 18th, 1993.
Lindsay Carruthers, January 18th, 1993. Okay, Lindsay, what brings you in today?
I'm just here for an assessment.
For a physical assessment?
Mhm.
Okay, good. And Lindsay, today we're going to go through a head to toe physical assessment for you. And on top of that, it's going to take about 15 to 20 minutes. Is that okay?
Mm-hmm.
Okay, wonderful. And Lindsay, do you happen to have any pain that you experienced today? I have this pain chart here. Could you rate any type of pain if you're having 10 being the worst pain of your life and 0 with not any pain at all, and any numbers in between? Are you experiencing any pain?
No pain.
Oh, no pain? Okay. And are you on any types of medications or have any allergies that we should let the doctor know about that may not be in your chart?
Nope.
No? Okay,
No
great.
allergies, no medications.
Okay, good. And then have you had anything new come up since your last visit with the physician?
Nope.
No? Okay, great. And for the next step, I'm going to go ahead and I would let Lindsay change into a different outfit or give her some privacy and close the door. And as I leave, at this point, I would leave and Lindsay would change into a type of a gown or something so I can perform the physical assessment. In this case, I'm going to be staying in the room and she's going to be wearing the clothes she has on today for this video. Also, we would be going through and doing the vital signs, but in this case, we've already made a video for vital signs. So right now, we're just going to be going through the head to toe physical assessment. All right, so next, Lindsay, I'm going to go ahead and wash my hands. I'm going to be, for this case, I would have washed my hands already, but instead I'm going to be using this hand sanitizer here. To start off today, Lindsay, do you know where you're at today? Do you know where we are, what place we're at?
I'm at the doctor's office.
Doctor's office, okay. And do you know about what time it is?
It's noon.
It's noon, okay, great. And then, do you know your presidents very well?
I decently.
Decently? Do
Yeah.
you know who the president was in maybe 2010?
Barack Obama.
There we go, that's great, yeah, that's a good long-term memory there, Lindsay. And then short-term memory, do you know what you ate for breakfast today?
Granola.
Granola, that's great, okay, excellent. Next, I'm going to go ahead and I'm going to be examining your eyes. For this, we're going to look at, I'm going to have you look at my pen light. I'm going to have you go ahead and follow the light, or follow the pen. At this point, I'm moving the pen back and forth to check for her pupil movements and to see if there's any abnormalities from left to right in her eyes. Now, Lindsay, I'm going to have you follow my pen for these 9 different points. We also take a note of any color, if there's a red color or a swelling of the eyelids, anything like that, any type of abnormalities, we're taking note of that as we are doing this examination. Very good. Now, Lindsay, I'm going to have you look into this light really quick. This is going to be kind of fast. I'm going to have you look straight ahead and look at me. Very good, looks great. And for this, we're going to make sure just to see that if her pupil is going to constrict or dilate on the presence of the eye, or presence of the light in the eye. And also for your pupil size, Lindsay, your pupil size was at 5 millimeters, so I think it's still in a good range. Next, I'm going to look at your oral cavity. So I'm going to go ahead and at this point, I'm also going to take a note of the patient if looking at their hair to see if they have rough hair, thin hair, anything that's different than what they would have previously had before if we have seen that patient, and take note of their skin to look if they have any lesions or any type of scarring on their skin. But for this first part, I'm gonna go ahead and look at this. I'm gonna look at your oral cavity, so I'm gonna have you open your mouth. I'm gonna use this pen light as well. Can you go ah? And I'm gonna have you lift your tongue up, and then go to the left, and then to the right. Very good. And then you clip your tongue back. And we're also taking note of any color, discoloration in her mouth, any type of imbalances from left to right. You can go ahead and close your mouth. Thank you. We're also looking to see if there's any symmetry with her face, and if she's had a stroke or anything like that, we would be able to see if there's one side drooped more than another. In Lindsay's case, she does not have any of these facial features. Everything looks normal from left to right, and it's all symmetrical. Inside her mouth, there was a good pink color. There wasn't any white or red abnormalities we would see on either side, any lesions in her mouth. Let's see. And next, I'm going to go ahead and take a look at your jugular vein here. Look underneath and palpate and see if there's any type of distension. And for this, we just made sure there's no swelling or inflammation on that jugular vein. And let's see. Next, we will. I'm going to go ahead and look at your. Like I said before, I'm going to look at your skin. So I will have you look here. Just examine if there's any type of lesions or cuts or bruising. Also, I'm going to do the same thing with your legs to check for any type of swelling, if there's any edema, or if there's any type of cuts or lesions. That's good. Same thing on this side as well. That's very good. All right, and then the next stage, I'm going to look at your skin. I'm going to look at your skin to see if it'll have good turgor in it. So for this, I'm going to go ahead and look underneath feel underneath Lindsay's clavicle right here. And we're going to check on both sides bilaterally. So for this first part, I'm going to go ahead and touch you right here. And check to see if Lindsay's skin can pull out and go back in. See if it has good turgor in it. Very good. Thank you, Lindsay. And the next step we're going to do is we're going to check to see, can I see your nail beds? Thank you. We're going to be pressing on her nails for this, and we're going to be looking to see if she has good capillary refill. We're going to be checking her feet or her fingers, and while we're at it, she has her shoes off, so I will also go ahead and check her toes, just to see if I'm pressing down on her fingernails, and the color change will come back to normal within a 1 to 2 second, very fast time frame. Let me check this hand as well. I'm also going to check your feet. Thank you, Lindsay. She had a good capillary refill. The color came back to normal within 1 to 2 seconds, just like we want. It shows good circulations in her fingers and within her toes. Next, Lindsay, I'm going to go ahead and listen to your heart. For this, I'll go ahead and get my stethoscope. I have my supplies all over here. I have the pen light, I have the pain chart, a thermometer, things I would use for vital signs like the stethoscope and the blood pressure cuff. And I also have the alcohol wipes and the hand sanitizer. I just wanted to say that I did bring all my supplies for this. For this first part, I'm going to go ahead and I'm going to be touching. We're going to be listening skin to skin, and I'm going to be reading under the 5th intercostal and looking underneath on the mid-clavicular line. Lindsay, I'm going to be going ahead and touching skin to skin here. Is it okay if I go ahead and listen to your heart? Thank you. Next, we're going to be listening to the different sounds. There's an S1 sound, which is the lub, and the S2 sound, which is the dub. For lub, we're listening for lub dub. We're also going to be checking out for 4 different sounds, or 4 different areas, the different mitral valves, or the different valves in the heart. The first one will be this is the first one we're going to check. First valve is going to be the aortic valve. And this is at the 2nd intercostal. And then the next one is going to be on the opposite side. We're going to be listening to the tricuspid valve. Next we're going to be going down to the 4th intercostal. And this is the mitral valve. I apologize. This is the pulmonary valve. And then down below is on the fourth intercostal, we're gonna be listening to the mitral valve. Very good, Lindsay. And next we're gonna go ahead and be listening for her radial pulse. Checking for her radial pulse, and we're also gonna be checking for her pulse in her dorsalis pedis on her feet. I'm gonna go ahead and take your pulse here. For this, we're gonna be going ahead and doing this for 30 seconds. If we hear any irregularities, we're gonna be doing it again for a full minute. Very good. Now I'm going to go ahead and check into her dorsalis pedis on top of her foot. And while I'm doing this, I'm also going to be looking at Lindsay's chest and taking note of her breathing. Right before, we're going to be counting her respirations. We won't tell her about this just so she doesn't change or augment her breathing. But we want to see if check the deepness of her breath, the quality of her breaths, and see how many she'll take in a minute. The healthy breaths per minute would be 12 to 20. We're going to see where Lindsay is at in that 30-second time frame. Thank you. And then also for her breaths per minute, we have Lindsay breathing. She breathed 7 breaths in that 30-second frame. So if we double that over, it'd be 14 breaths for a minute, which she's in a good healthy range for that, the 12 to 20. Next, Lindsay, have you had any pain in your chest? Have you had any pain with breathing or in your everyday activities? No? Okay, good. And then also I'm going to be checking for edema like I did before on her feet, checking as well with her hands. Good. So breathing's okay, everything's normal, like it feels regular. Good. And then next we're going to be having Lindsay, I'm going to be listening to the front of her chest, front of her lungs, and the back of her lungs, just to check the quality of her breathing. Yeah, that's right. I'm going to be checking 3 different areas in the front. Just breathe regularly. Also checking from side to side with Lindsay's breathing, making sure the lungs sound equal from left to right. Lindsay, can you also go ahead and take a deep breath for me? And blow out. Thank you. Do another deep breath for me? And blow out. Thank you. Next, I'm going to listen to her breathing from the back. I'm going to go from top to bottom, left to right. Check everything symmetrically. Lindsay, take a deep breath for me right now. Breathe out. Thank you. You breathe it again. Very good. That's okay. Good. One more time. Exhale. One more big breath. Good. Now have you breathe regularly? Breathe normal. Very good, thank you, Lindsay. One last thing I want to check just with your hearing. I'm going to go ahead and it's going to seem kind of unconventional. I'm going to have you cover your left ear. Sorry, your left ear. And then I'm going to go ahead and stand over here. I'm going to whisper a word to you. Let me see if you can repeat it to me. Peanut butter. Did you hear the word that I said?
I got it.
What word do you think it is?
Peanut butter.
Peanut butter. Okay, good. Next, I'm going to have you cover your right ear. And then I'm going to stand over here, and I'm going to whisper a word? Ice cream.
Ice cream.
Ice cream. Okay, good. So peanut butter ice cream. Very good. Thank you, Lindsay. So your hearing sounds good on both sides. Everything sounds normal. Next, I'm going to go ahead and just make sure that your movement's okay. Can I have you go ahead and stand up for me? All right, good. For this next part, I'm going to have you I'm going to put my arms out, and I'm going to have you try to push my arms. See if you can push as hard as you can. Push. Good. And I'm going to have you try to move my arms now. Can you try to move them from left to right? Yeah, move. Good. Strong. That's good. And then next, Lindsay, I'm going to have you come toward me and stay still. And I'm going to try to move you back and forth. I'm going to have you try to hold still with your legs and make sure that I can't move you or knock you off your balance. Okay. Good. Okay. And then next, I'm going to have you hold on to my arm and see if you could stand on one foot. It's kind of tricky. Good. Now maybe do the same thing on the other side. Hold on to my arm. Or the railing right there is great too. Either whatever you prefer. One foot. Good. Thank you, Lindsay. And next, I'm going to have you lay down on this fine table we have here. I'm going to go ahead and lay on your back. We're going to have you lay on your back, and we'll be checking your stomach and your abdomen. I'll also go ahead and get you this nice pillow here as well.
Thank you.
You're welcome.
This is really luxury treatment here.
Yeah, we do good things in this hospital.
Yeah.
Okay.
That was at the doctor's office.
This doctor's office. All right, first we're going to go ahead and we're going to be checking the abdomen. We're going to be observing, in this case, we would normally be observing skin to skin here. So for this part, we're going to go ahead and see, there could be 4 different areas of the abdomen. We're going to go and just check from left to right, up and down, to see if there's any type of abnormalities or lumps, obtrusions, anything that's kind of sticking out, or maybe a blocked bowel movement, anything that's in there that is obstructing. We're going to look to see if we have that. We're going to be looking at 4 different quadrants as well of the stomach. We're going to be breaking this down into the upper left or upper right quadrant, upper left quadrant, bottom right, bottom left. We should be examining it and make sure that all looks symmetrical on each side. Good. And then also we're going to be palpating the urinary area or bladder area. We're looking for any type of distension, if there's anything sticking out, if you see anything that's out of the ordinary, we want to take note of that. Lindsay, also at this point, you can put your shirt down. This next point, I'm going to stand you back up and I'm going to ask you some questions. I'm sorry about that. You're just fine. You can sit back down. And so as far as your stomach and anything in your abdomen, have you been having normal bowel movements? Yes. And then as far as your urine, is it all, what kind of color is it in? Bright yellow, dark orange? Is it are you
Nice and hydrated.
Nice and hydrated, okay. And as far as smell, does it smell normal?
Mm-hmm.
Everything seems normal and
yeah,
regular?
yeah.
Okay. And then are you using the bathroom regularly? Like regular, normal?
8 a.m.
Okay, 8 a.m. normal. Okay, that's good to know. Good to know. And then, are you having any type of pain or nausea as far as with your stomach? No. Okay. Well, that's good to know. Anything else as far as concerns you may have for the doctor that I could bring up? No. Okay. Lindsay, your head to toe assessment is complete. You did great. At this point, you don't have any other questions. I'm going to go ahead and get the doctor. He'll be in shortly. About 5 minutes. It was nice to meet you, Lindsay. Have a great day.
Thank you.
Thank you. Bye-bye.
Bye.